22 million black victims of Americanism are waking up, and they're gaining a new political consciousness, becoming politically mature. And as they develop this political maturity, they're able to see the recent trends in these political elections. Any minority that has a block of votes that stick together is in a strategic position. Either way you go, that's who gets it. You're in a position to determine who go to the White House and who stay in the doghouse. You're the one who has that power. You and I have never seen democracy. All we've seen is hypocrisy. Today, and look around America, we see America not through the eyes of someone who has enjoyed the fruits of Americanism. We see America through the eyes of someone who has been the victim of Americanism. We don't see any American dream. We've experienced only the American nightmare. We haven't benefited from America's democracy. We've only suffered from America's hypocrisy. And the generation that's coming up now can see it and are not afraid to say it. And are not afraid to say it.
And are not afraid to say it. Welcome, welcome, welcome. You're tuned into Black Westchester Presents the People Before Politics radio show, episode number 409. As you've heard in the last previous shows, celebrating our 10-year anniversary, giving you that real talk for the community since 2014. I'm working on the second of our 3 10-year anniversary issues, which is going to print next week. So the next couple of days is the last day to advertise in that issue. And of course, we're here still standing because of all of you. In the ticker, you'll see ways that you can make donations. Your donations help us keep the radio show, the newspaper, and the website free for everyone. Without further ado, let me bring on my co-host, Dr. Robert Baskerville. Say what's up to the people.
Hey, what's up, everybody? AJ, what's happening? It's a pleasure to be with you and the rest of your audience tonight. So yeah, thanks. Always good to be with you, bro. Let me stop acting like I'm a newbie or something.
Right. He said that like he's never been on the show, like he wasn't co-host for over 100 episodes. Probably closer to 200. Yeah. And like this is the first time he's been on here. So we have a guest tonight. Introduce our guest. We're just gonna get right into it. She's here. So introduce our guest. Yeah.
So everyone, it's a pleasure for Black Westchester to bring to the studio tonight Dr. Maureen Beverly. Dr. Beverly is a medical profession who has decades of service in the medical field, starting with her early service at Harlem Hospital and continuing on progressively up the ranks of the New York City Health Hospital System, and culminating today in her transition to consultancy work in the area of managed care. To be honest with you, Dr. Beverly's work in many respects dovetails with some of the ongoing concerns of all of the hosts here at Black Westchester People Before Politics as it relates to the treatment of Black people, people of color. You will recognize, AJ, that concerns that you have had, you and Damon have expressed about implicit bias, especially of law enforcement personnel, is paralleled by Dr. Beverly's focus on the many kind of biases in the healthcare system, which often undermine the quality of the kind of treatment that are received by America's patients, above all else, African Americans. And so Dr. Beverly is going to discuss her insightful guide to solutions for some of these problems, newly published, I believe this year. I'm not going to try to look at the copyright page, but it's entitled 9 Simple Solutions. Let me see if I can get this right without blocking myself out. Okay, 9 Simple Solutions to Achieve Health Equity, a guide for healthcare professionals and patients. And I do want you guys, all of our audience members, to know that it's filled with numerous insights that will not only serve healthcare professionals well who want to ensure that they're giving the best quality care to their patients, but patients as well who want to be enter into a relationship with their medical professionals, not just as passive recipients, but of active active members of their own healthcare treatment. And this guide provides you with many of the kind of questions that any informed patient needs to be armed with as they go to receive treatment. And I guess without further ado, let us welcome Dr. Morvarine Beverly.
Welcome to the show. Welcome to the show. How are you? Hello.
I'm great. How are you?
Yes.
So Dr. Beverly, we can't see your image. I don't know if that's intentional.
I don't know.
It looks like you have a still picture up instead of your live picture, which I don't know how you do that. But we'd like to see you talk when you talk. Though.
Right. Hold on 1 second.
And AJ, I'm not going to tell you there's something wrong with the feed across my line. I can't see Dr. Beverly's image at all. I just see a blank screen, but a black screen, but it may be a problem with my computer.
Oh, it might be, because I'm looking at it on.
I can't find my screen.
On YouTube, on Facebook, on Twitter. I see her, but it's like a still image. So while we're going, you were reading the book, Bob.
Yes.
Want to give us a little brief synopsis about the book until she works that out?
So it's partly autobiographical, partly professional reminiscence of Dr. Beverly's experience in treating patients in the New York City area for 30 plus years of her career, and focuses in very closely on the social roots of a lot of the ailments that people suffer from today, and specifically how doctors themselves, who are, members of our culture, oftentimes bring with them preconceptions that can actually lead to, if not outright misdiagnosis, certainly to the misprescription, if you will, of healthcare. Now, I know Dr. Beverly is having challenges trying to get her image on screen, and that's all right. Dr. Beverly, I'm sure you can hear me.
I can.
Yes, and perhaps as you try to find the appropriate controls so that we can see you, Dr. Beverly, I wanted to maybe just continue our conversation and bring you directly into the discussion. Okay.
We lost her altogether.
Yes, we lost her altogether, and hopefully that means when Dr. Beverly logs back in, she'll see the button to share her image. I think that maybe that might have been part of the problem.
Yeah, because her camera's not on at all. I see her in the green room.
You see her in the green room now?
I see it. She never left the green room, but her image is not on the screen, and then now it says device not connected. So she's having technical difficulties. Hopefully we will get them solved. But go ahead and talk about the book.
Yeah, so really to give everyone, the audience members, a flavor of the book, I want to share with you guys one of the key quotations around which her entire analysis is organized. Before I share the quotation, though, I do simply want to note that the book is written in a very accessible and yet insightful style and is appropriate for people of all different backgrounds. You do not need to be a medical professional in order to.
Can you hear me?
We can see you now, Dr. Beverly.
Can you hear me?
Absolutely.
And we can hear you. Wonderful.
Thank you so much. I'm so sorry for the glitches that occurred.
No problem. Technical difficulties. It's a beautiful thing. We used to do this in the studio. I kind of missed the studio, but this is life, makes life easier for everybody. So it's supposed to be, and it doesn't always. So It is what it is.
Yeah.
So, Dr. Beverly, I was telling our viewers that the book might be considered partly a partial reminiscence of both your personal experiences growing up in New York, as well as your professional experiences in a medical system that is has systematic problems in treating people of color, especially. And having read the book, I really honed in on this a quotation that you cite repeatedly. I don't know if you could see it on our screen, but it really does encapsulate the basic problem that you see with medical care as it relates to persons of color. And so it'll give me a joy to read it, even though everyone can see it. Difficult patients are not just born, they are in part created by their passage through the medical system. Not only has this system failed to cure, but it may also have done unpleasant things to make matters worse. You really highlighted this as a quotation that would help serve as a guidepost to help your readers understand what you see as the basic problems. Maybe you could start off by elaborating using this quote as a starting point for our discussion.
So, good evening, everyone. And as I said, it's an honor to be part of the conversation on Black Westchester magazine. I think my book, as you mentioned, 9 Simple Solutions, a guide to healthcare professionals and patients, came as a result of me speaking to over 1,000 patients of all ethnicity, race, and belief system. And it was in 3 hospitals, Elmhurst, Queens, and King County Hospital. And the reason I just want to give you a little backdrop is that at Queens Hospital was a large, predominantly Black population. At Elmhurst is a large Asian, Indian, Hispanic population, and then a growing Russian population. And in Kings County is what I call the merging of the African diaspora, where you had a lot of the population was predominantly Black, Caribbean, African American, and the Panamanians. And the Spanish population was Panamanian. And under colonial rule, the British sent the English-speaking population from the Caribbean to Panama to build the canal. So phenotypically, they look Black. Their names are not typical Spanish names. They're English and Spanish: Ronaldo, Austin, Antonio, Martin. And it's as a result of speaking to such a large population, I came to the concept of the common thread, the human experience, as a driver to begin with. And so what do I mean by that? Irrespective of race, gender, ethnicity, cultural beliefs, socioeconomic status, once accurately diagnosed, the disease cannot be given back. Why do I say the billionaire can't say, I'll give you $1 million to give the cancer back? Oh, that's enough. I'll give you 5 million. So it applies to a homeless person as it does to a millionaire. In life, we have choices. You don't like your school, your kids go to, you change. You don't like your family, you could move to another state. You don't like your job, you could move. But once accurately diagnosed, that's the common thread. There's no one that could give it that. And maybe health systems across the country could be more empathetic and less judgmental to populations served. In terms of the statement that you referred to, it's a powerful statement because it relates more to patients that with sickle cell disease. Mm-hmm. And they're predominant in this country. 1 in 365 patients have sickle cell disease. And it's as a result, their life expectancy, once they get to the adult world, their treatment and how they're perceived is just, unconscionable. The notion that they would be called drug seekers when they're the least addicted and the most vilified for patients who require pain management. And sickle cell disease is an excruciating, a painful situation when one goes into crisis because the red blood cells sickle and it makes it difficult for blood and oxygen to go through the organ, to go to organ system. And as a result, there is unimaginable pain as well as people end up with strokes, heart disease, kidney disease, infections. And the notion that once they're in the adult world, they are called drug seekers is unconscionable. And that's where the statement said difficult patients are not just born. Sometimes they're created through the medical system. Not only the system failed to cure, it may have done unpleasant things to make matters worse. And it was related to, as I said, I developed at Helton Hospital before, in my present position as president and founder of Maureen Beverly, MD, PLLC, Patient Engagement and Cultural Competence Specialist, I developed the first care management program there. And the whole concept of the care management program was interesting. I created the concept of the bridge team. And the whole idea of the bridge team is to bridge the gap. Whatever the gap is, that's the role of the bridge team. And the most vulnerable population was patients with sickle cell. That was in Queens Hospital, and is what I referred to. Yeah, sorry. Go ahead.
So, Dr. Beverly, before we go into discuss the details of the managed care program that you put together both at Queens Hospital and later at Kings County Hospital, I'd first like you to elaborate just a little bit more about the ways in which the preconceptions of medical professionals undermine quality healthcare. You just mentioned a moment ago that one of the common practices, unfortunately, in the treatment of sickle cell patients is to inappropriately label them as drug seekers.
Right.
And indeed, this is just one of several labels that you urge medical professionals to rethink the use of when dealing with patients because it may bias them. Why don't you say a little bit more? We've been having a lot of discussion lately about the under prescription of pain medication for Black patients in particular. And it seems like the whole one of the problems in sickle cell treatment that you discovered is a similar kind of thing that's captured in this idea of labeling people as drug seekers.
Okay. I think I just want to make a correction. It's not that I developed a managed care program. It's a care management program.
A care management program.
Yes. And what's been proven in the medical literature, the reason why patients with sickle cell disease return to the emergency room more often than the team expected in the emergency room is because they were undertreated the first go round. And that's why they return. And that's been proven in the medical literature. And
so how specifically does that undertreatment relate to the prescription of pain medication? Because I know that's something that you highlighted in your discussion as especially harmful to sickle cell patients.
Well, if a patient is undertreated and returned to the emergency room, the patient engagement for that individual is going to be significantly less than it should be, because in the mindset of the individual physician may be that they are now coming back earlier because they are drug seeking. And so they would wait in the emergency room longer times than necessary, sometimes 6 hours, once assessed, before they would get to see a physician. And that's been proven. The wait time in the emergency room for patients with sickle cell is a lot longer than any other patient when they consider pain as a reason. And so in the context of that perspective, and again, it goes back to how the patients with sickle cell disease, 1 in 365, because they're, from my perspective, because they happen to be African-American/Black patients. They would not be treated this way if there were somebody else. And one of the things that we are looking to change that dynamics is how do we have a better system to change the system? Because if the system is toxic, whether it's be in the emergency room, inpatient, or ambulatory care, then regardless of where that patient is, chances are there's a high probability that they would be considered in a negative light. And particularly now that we have shared medical records where everybody could see the language of negativity, it impacts patients as well. And it's not only just that language, it's the language of non-compliance and non-adherent. and I could explain that as well if that's something that you want to hear at this point.
Well, besides drug seekers as one of the disparaging terms, labels that is often used by medical professionals, which you maintain dissuades people from seeking the treatment that they need, there are other equally loaded, biased terms that are used. Non-compliance and non-adherence being probably the most pernicious in your view. But before we go to those, what are some of the other kind of terminology that you frequently found medical professionals either using in discussions or even as part of your care management program discovered in medical notes that your research team reviewed?
Well, I think those two languages to me is pivotal, because the majority of negativity in the medical records, particularly the language of non-compliant, non-adherent, is geared towards Black patients, and it's been proven in the medical literature when you have that languages, and particularly more geared towards African-American males. One of the other language that I think, well, it's not part of the language, is that nobody discusses what I refer to as patient fears, the fear factor. So you could see how fear factor could add to someone being non-compliant. So there is, and like I said, those are the two languages that I think is pivotal to the change in the healthcare system.
Right. Now, in order to demonstrate this, illustrate this for your readers, you also highlight a couple of key instances from your medical career where you could see these kind of biases in terms of language and the kind of preconceptions that they give medical professionals of the root causes of ailments that Black people in particular suffer from and how it influences their medical treatment. Can you give us an example?
Well, yes. So I was in charge of the congestive readmission prevention program at Kings County when Medicare stated that if the patient gets readmitted in 30 days, they'll only pay for one admission, whereas prior to that, they would pay for 2, 4, 6, 8, 10 as admissions. And so if for no other reason, each system across the country had to develop a program to decrease readmission for 30 days for heart failure patients, if for no other reason, financial. And one of the things that it was very important for my team is to ask the why question. If somebody didn't follow directions, we would need to know why. And currently in medical records, people just write non-compliant, non-adherent. When I do presentations, which I did on patient engagement and cultural competence, and I did at a hospital, and 60 people are in the room, clinical and administrative staff, and I asked, how many times have you heard or seen the word non-compliant? Everybody raises their hand. But how many times have you seen the why question related to non-compliance? Maybe 3 people. And I'll give you a typical example. 60-year-old African-American male, recently diagnosed with congestive heart failure, returns 3 weeks later, heart failure decompensated due to non-compliance. So when that patient goes up to the unit, I don't care what hospital, you think anybody's going to care about that person? And one of the nurses down the hall said, so he just got diagnosed with a life-threatening condition and doesn't follow directions. I got other things to do. My team had to ask why. And I said, ask patient, why didn't he take the medication? And the team refers to me as Dr. B. And they'll say, if you don't ask why, Dr. B is going to bug out, And they said, why didn't you take your medication? And he said, I can't take the water pill. Why can't you take the water pill, which is a diuretic that used to flush this fluid out of the body so that the heart could pump better, and it makes the patient urinate enough? Why can't you take the water pill? Because I drive the number 7 train. So when is your shift? 11 p.m. to 11 a.m. What do you do when you get home? I do some chores, make breakfast, take some of my medications. But if I'm going on my shift, I don't take the water pill. The average patient with heart failure is taking about 5 to 6 medications, probably 2-3 times a day. And so he can't take the water pill because they can't say, oh, the train is delayed because the driver has to find a bathroom. We brought in the same cardiologist who was ignoring him as well. And he said, okay, when you get home, take the water pill, the diuretic. Be aware it may wake you up. It may wake you up during the day to urinate, but to the degree when you get to your shift at 11, you'll have less of a reason to urinate. But to the degree that you do, we're going to give you a cubicle to use in the private space when the train stops. And you know what the patient said? If I knew I had to choose between peeing and breathing, I would have chosen breathing. And I go at conversation, I said, expand the conversation. Without the why question, he would have been readmitted multiple times. And then now there's a more negative words, frequent flyer. That means person is always coming to the emergency room for unclear reasons and just coming to the emergency room. And if he were to pass at mortality, it would have said died due to non-compliance. Just a simple question of using the why question, we were able to save this gentleman's life and to put him in a position that he doesn't have to choose between his health and his job. And we found that when we asked the why question a lot, we were able to have a better collaboration with patients and family. So that's just one example. Yeah.
Mm-hmm. So this why question that you urge medical professionals to ask as part of a care management program really is intended to put the patient in a holistic kind of experience and ensure that there are important aspects of the patient's experience that may impact their health that medical professionals don't inadvertently overlook because of the narrow focus. So one of your real contributions is that you played a leading role in designing some of the newer care management programs in Queens Hospital and subsequently for sickle cell disease, and then for congestive heart failure at King's Hospital, if I'm not mistaken, if I'm not confusing the facts.
Yeah.
Can you tell us exactly what this care management program entails? What kind of new innovations did you introduce that have, and what has been the impact of these programs on the health of their target recipients?
I think the impact of the program is very demonstrative because what I'm looking for is sustainable results. We could go from health disparity to health equity, and it may last 1 or 2 years. But what I'm really focused on is sustainability of health equity. And the bridge team, that's one of the unique concepts that was developed, the bridge team, bridge the gap. And so the bridge team is still operational in Elmhurst today. And the sickle cell support group that I developed is still operational. It used to be in person, but it's now on Zoom, And so the heart failure program has changed because there's been change in management from what I believe, but they're looking to focus, but there's still a focus on improving the health of the heart failure patients. And one of my focus is to bring to the attention cultural competence. Cultural competence has to apply to American-born physicians to foreign-born patients, but also foreign-born physicians to American-born patients, and American-born physicians to American-born patients who are different than themselves. And clearly, heart failures are age-related. The bulk of the patients were between 60 and 92, even though we did have a young 23-year-old, which we refer to in my book as our baby, And I think it was important, and what I described is to understand, is what I refer, we have to understand, even though we look alike, we're from the same ethnicity, but we're in the same location, but what we have to do is to make sure we understand the unique cultural differences of the population. And so one of the things that when I do presentations, I refer to as the lookalike syndrome. So I said, go tell a British person they're Irish and see how far you get. Go tell a Chinese they're Japanese, they'll see how far. Go tell an Indian they're Pakistani. Go tell a Nigerian that they're Ghanaian. Go tell a Jamaican that they're Trinidadian. And most important, go tell a New Yorker they're from New Jersey and see how far you get. Because it's important to understand these unique cultural differences. And it was so important that Kings County, as I said, was the merging of the African diaspora. And what was clear is to recognize why I say that. So we would go into the bridge team concept. We have this what's called now 30-day readmission prevention team.
Yes.
And we would go and see a patient, and she was 80. We would give you an example, African American. And I said, and we had to know where you're from. So we said, good morning, and could you just tell us where you're from? And she said, South Carolina. And I'm thinking, is she visiting New York for a family event and got sick, or does she live here? Because the transition of care would be different. And before I could ask her that question, Monday morning, 9 o'clock, her response was, my parents were a step away from slavery and my grandparents were slaves. Was I expecting that Monday morning, 9 o'clock? And I said, tell me about it. And she said, my family picked cotton on a plantation that was not ours. And we had to get up the crack of dawn and pick 300 to 500 pounds of cotton. And then I had to walk 10 miles to a segregated school. And I'm thinking, 10 miles? We can't even go 5 blocks without calling an Uber, you know? I said, how do you walk 10 miles? And her body language changed. She said, if you wanted an education, you had to. It's almost like, what part of this don't you get, stupid? And I said, did you have to walk back? She said, no, the principal in the horse-drawn carriage took them back, and they had to get back before dark, before the Ku Klux Klan. I said, how old were you? She said, 10 years old. Could you imagine the trauma that's involved? 10-year-old? You know, and she followed up her education, and she went to Voorhees College, a 2-year black college in, I think, South Carolina. And this is almost 60 years later. You know what her response was? She was still upset with herself. She said, I didn't get in till my second try. You know, so she came to New York, and migration, most people from the South to New York was in 1930s, 40s. And as a result, is after the Emancipation Proclamation and blacks had their first representation in Congress, their communities started to do better than the white communities. They built church, they built schools, they built businesses. The plantation owner property went south because nobody was picking the cotton. And over the course of time, the Ku Klux Klan came in and burned the whole place down, and they came up the coastline to New York. And so the bulk of the 95% of the cohorts of African-American patients that we were treating were from the Carolinas. And the top Caribbean island was Jamaica, Trinidad, Haiti, and Guyana. And I just want to follow up on her story. So she came to New York, married in the 30s, and most black men, there are a lot of high percentage of black men either worked on the subway systems, the public transportation system and maintenance. And she got married. She had 2 children, and her 2 children, I don't know if you're familiar with the school, Stuyvesant High School. Her 2 children were 2 of 5 black children to integrate Stuyvesant High School. And when I say to her, you know, and I tell my team, and giving this as an example, when you make an error, whether you thought about whether you thought you made an error or not, if the patient in that bed felt uncomfortable, apologize. And why do I say that? I said, you know, you're going to need home care. And she said, I don't want anything that's not mine. She thought I was giving her a handout. And I said, I'm so sorry. Maybe that's not what I meant. Maybe I did not explain it as best as I could. And I made care to think about my language. And I said to her, everyone that has Medicare, I didn't use the word entitled, everyone that has Medicare, home care is a part of Medicare. And she said, everyone? I said, yes. And she said, okay. And this is where you have to understand from her background, the cultural competence is not applied to particularly the black elderly. And the role of religion in this population, you know, we have examples of, you know, and just a quick example. Patient was admitted, she was doing fine, and on Wednesday, she stopped eating, she stopped participating in her care. And, you know, everybody said, we have to call psych, we have to do depression screening. I said, absolutely. I said, let me go in and speak to her. And a key question that the team now embraced was, I said, could you tell me what's important to you? Not what I think should be important to you. I didn't go to chastise to say, well, you know, your healthcare is very important. You have to do this. You have to continue your medication. You have to participate in your care. I didn't go that route. I said, let her tell me what's important to her, not what I think should be important to her. You know what she said? That I won't be going to church on Sunday. This was a Wednesday. She felt guilty of not being able to please God. I said, yes, we have to do the psych consult and depression screening. Find out what church you go. Found it ministers, the church. I spoke with him. He came in and prayed with her. And you know what he said? Even if you're not discharged on Sunday, I will come back and pray with you. She was a different woman because now she doesn't feel guilty of not pleasing God. And this part of the cultural conversation, particularly including religion with African American, particularly the elderly, who has the worst health outcomes of all disease categories when you consider the atrocity that they dealt with. And I say when I do presentation, I said when a Holocaust survivor comes in the hospital, we roll out the red carpet. The chief medical officer, the board of directors, the CEO, the rabbi will go and see that patient. And so they should, because of the horrific circumstances that they endured. But when an elderly Black person who fled the South because of Ku Klux Klan, lynching, and Jim Crow, how come we don't rule out the red carpet? And it's an opportunity to treat all atrocity survivors the same and to recognize the role of religion in both populations were pivotal to their survival. And obviously, heart failure is age-related. And one of the other things that we don't cover in healthcare is patient fears, the fear factor. So you could see how fear factor could lead to, quote, non-compliance. And if you have a moment, and these are what I'm saying in my book, and these are what I call stop in my tracks moments that led to boots on the ground, simple solution that came from patients. Yes, I had developed the care management program. I had the bridge team, but these interactions caused me to expand my mindset. And patient with kidneys were failing. And he and his wife, they kept appointments every month for nephrology and in the nephrology unit. And the doctor just kept writing, patient refused dialysis. So he was admitted as his kidney functions were worsening. And I said, if anybody speak to his wife, because if anybody's going to convince him, his wife is going to convince him. And I said, does his wife come to visit? They said, yes. She comes every evening after work. I waited to see her after 5 o'clock. And I told her, I know you love your husband, but you really have to convince him to take dialysis, because if you don't, he may not be here with you much longer. And she said, I don't think I want to do that. And I'm thinking, what? But I composed myself and I said, tell me why. And she said another powerful statement. I don't think I could live with myself. That's a powerful statement. And I said, why do you feel that way? You know what she said? Our neighbor down the hall went on dialysis and 2 weeks later he died.
Mm.
So could you imagine, would any of us be rushing to put our family on dialysis? And that's when I realized the fear factor. So I reached out to the same nephrologist who just wrote patient refused. And that's why I really believe we could change culture with the patient engagement and cultural competence training that I did. And I explained the circumstance. I said, they need hand-holding. And he went to see them and he said, I don't know why your neighbor passed. Could have had a stroke, could have had a heart attack. His kidneys could have failed. But one thing I will tell you, if you agree to dialysis, I will be there with you for the first week. Nephrologists don't go to dialysis. So this is the same physician that was just writing patient refused and now recognizing the need for handholding for this patient. And the fear factor became a prominent part in some of the concept that I developed in terms of what I call the SPOT methodology.
Right.
So let me ask you, so as an author myself, so what led you to write this book? Did you find that the information that you provided wasn't readily available? The need to explain this, to explain what our people deal with in the medical system?
Yeah, I think why I decided to write this book, and let me just go back. I think it's, in a certain way, it's related also to the training that I did at Harlem Hospital under the leadership of Dr. Gerald Thompson, who excellence in healthcare was expected, whether you were a churchgoer or whether you were addicted to drugs. Excellence in healthcare was the mandate for all of us. And in fast forward now, years later, I had the opportunity to develop a program, and I think it was probably in my brain that was part of the mindset. But I think why I decided to write the book about this topic is after speaking to over 1,000 patients. And what I did was what I call perception reality. The same surveys I would ask the doctors is the same survey I would ask the patients to see if we're on the same page. I'll give you an example. Why don't patients take their medication? I asked the staff in the emergency room and the inpatient, nurses, social workers, physicians, and everybody said cost. They can't afford it. It's the cost. And one of the doctors said, well, if they can't afford it, what do you want me to do? Call the social worker. Because the average heart failure patient were taking 5 to 6 medications. This is in Brooklyn, you know. So what if I told you when I asked the patient, why don't you take your medication? What if I told you that not one patient mentioned cost? You know what the answer was? Why don't I take my medication?
What was it?
Huh?
What was it?
No. What was it?
Yeah.
They said, because we're taking too many medications. So then it was interesting. So if you're going to design a system based on cost, you see it's going to fail. So what we did, we brought in a pharmacist, an amazing pharmacist, who was able to work with the clinical team to collaborate in cutting down some of the medications. And so could you combine the diuretic with the antihypertensive? Yes. Does an 82-year-old still need to be on a statin medication for high cholesterol? Could we combine some of the anti-inflammatory meds, you know? And we were able to cut it down. And as a result, we did a presentation at the Patient Safety Council conference. And so that was key to why I decided all the things that I invented or used in these processes in terms of developing these programs. And again, it's a big thing that came from the voices of the patients. And that's when I recognize, when I read information on health disparity to health equity, I don't hear any solutions. I just hear we should treat the patients with dignity and respect. But if you don't value me, do you think dignity and respect is going to come into your mind? And so if we put systems in place that show sustainability, which is what my programs have done so far, I'm honored and happy to see that it's still operational, and understanding the patients. And like I said, some of the simple solutions that are just going to stand out is that the common thread, the patient engagement and cultural competence training that I do, the common thread, the human experience. And I think that concept relates to all individuals, whether you like the concept or not, but it's a fact. There's no one, a human being on planet Earth, could give the disease back once accurately diagnosed. Eliminate the negative languages. And the other one I'm just going to say, the spot check apply. S, speak to patients and family. P, pacify fears. O, outline what's important to the individual. And T, take into consideration the time it takes for someone to accept the disease. Because I recognize the fact the bulk of us taking care of patients never laid in a hospital bed. And those that do are women delivering life. And in certain cases, patients may be trying to prevent death. And so what I'm trying to do is to bridge these gaps. And as I mentioned before, the 3 definitions of where cultural competence need to be applied in order for this to be understood and activated. You know, we have, sorry.
That's all right, Dr. Beverly. I was going to say you have a very compelling example of the benefits of using the spot check technique. In your discussion in the book of the patient, I think he was suffering from congestive heart failure of some kind, I believe, who refused to take the medication because of his son. And yes. And it's a really simple but very compelling example of the benefits of extending the discussion about patient care beyond the patient, him herself, to include immediate loved ones who are authorized to be a part of that discussion. Could you just say a little bit about this particular gentleman and how son really did the trick?
Yeah, so this individual, he had diabetes, and he would come to the emergency room every other day. to check his blood sugar. And everybody just had it with him. You know, they called, now he was definitely in the category of frequent flyer,
Yes.
right? That's people come to the emergency room every day for what the staff thinks is totally unacceptable. So my team, the bridge team, they brought in and said, bridge team, you know, you go meet with this guy. This is crazy. And so we went in to meet with him, and he said, why? And I said, again, the why question, why do you come to the emergency room every other day to check your blood pressure? And there was a pride on his face. He said, my son told me to do so. And we looked at each other. Your son told you to do. Why do your son told you to do? Listen to his answer. Because my son knows what's best for me. His son just got moved from New York to New Mexico to college.
Right.
He's the first one in the family to go to college, and the dad was so proud of him. And one of the nurses said, so we're supposed to listen to a 19-year-old in New Mexico to tell what should be done? I said, listen to what he said. He said, my son knows what's best for me. He didn't say we know what's best for him. So if we don't bring his son into the conversation, nothing is going to change. So we were able to contact his son. And I said, you know, I spoke to him and I said, you know, why do you want your father to come? I know you're not there and your father is so proud of you. Why you want him to come? You know, I thought he was going to say that, well, you know, I'm not there to help my dad. So, you know, he has to go to the emergency because now I'm away, I'm out of state. And he said, he read an article, and the medication his dad was on, metformin, killed like 2 or 3 people in the world, and he was not about to make his dad be the 4th. So it's like millions of people on the medication. So I got back to the team, and I said, listen, we have to speak to his son and let him know that we'll do everything possible to make sure that his dad does well and his health outcome improves. So we got on the phone with him and said, you know, we're going to assign a doctor in ambulatory care with your dad. We're going to have a care manager communicate with you on a regular basis to see how your dad is doing. And would that be okay with you? And he agreed. And I said, your dad is so proud of you, you know, and I hope you enjoy your college experience. And again, it's the human factor. You know, once we start seeing somebody's behavior, we tend to put him in the negative category and without asking certain simple questions, because there is no way that without his son approving that he would stop coming to the emergency room every other day.
Where can people purchase your book? And anybody watching that might want you to come in and speak, you know, the organization or school or a lecture or whatever, how do they contact you?
So my website is Dr. Beverly in lowercase, and there's no dot between Dr. and Beverly, is DrBeverley.com. And there's a space there that you could order the book. And my email address is mbeverley@gmail.com. And let me spell it. MBEVERLEY, M like in Mary, D like in David, @gmail.com. And it's on the space where to purchase the book is available on the Amazon, is on my website as well. But it's on Amazon. And I just would like you to know that my book was published on Juneteenth, which is a federal holiday, the end of slavery, 1865, and it was my birthday. And so, yes, this is my website. And, you know, it's really been a great experience for when I do presentation, and it's really been well received. But I think it's a game changer. And like I said, the difference being a game changer is because the patients are included in part of the solutions. And that became sustainable.
I do want to add for our viewers that consistent with the demands of scientific rigor, these recommendations that you have not gone untested, and that as part of your care management approach, you also assembled data specialists from the medical health profession to actually analyze the data and to allow you to track those components that are effective, those that are less effective. And I just to put an exclamation mark on the kind of changes that your program has driven. You note in the book that one of the objectives was to reduce the amount of people who came back to King's Hospital within 30 days.
Yeah.
Right? And that was one of the main goals, was to try to bring those numbers down. And after about a year or so, there was a decrease in the 30-day readmission rate at King's Hospital from 30% down to 18.7%, more than a 30% reduction. And I think that speaks volumes to the effectiveness of these kind of approaches. And I hope audience members who are listening, who may be patients or medical professionals themselves, will consider implementing some of these innovations. I can say occasionally the director of the community healthcare system in Westchester County tunes in, so I know she's always looking for ways to improve the performance of her services, and maybe she'll reach out to you, Dr. Beverly.
Yeah, I just want to say thank you for that information. The 30% came from the then medical director at Kings County, and the 18.7 came from the central office called Medical and Professional Affairs, where they gave data every month. And it's interesting, the least educated on the team came up with the 18.7 before the data was brought to our attention. And so it also speaks to the fact, because somebody's less educated doesn't mean that they're less intelligent.
Right.
And I think we need to keep that into perspective. When people are not educated, they're assuming that that they are less educated. And to that point, I think I read an article a couple of years back. There was a highly educated group of individuals that were admitted for heart failure. And when they left the hospital, 50% thought they should increase fluids, which is totally opposite. And 25% did not know what heart failure meant.
Right.
So again, when you have a new disease, the question is, where is the person in the acceptance of the disease, and how do they understand the disease? And like I said, from my perspective, the perception reality, because if the perception of me is not the reality, my health is going to go south. But the perception is the same as the reality, good, bad, happy, or sad. We have an opportunity to collaborate, but it all stems from you not being judgmental as a clinical team. Don't start calling me negative language, and you don't even know why I'm going to do something, And like I said, it was a humbling and amazing experience. And like I said, I want to get this information out, and I want to tell patients an opportunity. If you're in the hospital, you're at your doctor's office, and they ask you, did you follow directions or did you take your medication? And you say no. Wait a couple of seconds and say, do you want to know why? And please don't write non-compliant in my medical records without asking me why, without the why question, because it could have a negative outcome on my health. Could you imagine if patients start to communicate that understanding to their providers? And, and it's the same with patients with sickle cell. State that statement. Difficult patients are not just born by Dr. Dempsey. Sometimes they're created through the medical system. Not only the system failed to cure, it may have done unpleasant things to make matters worse. Put that in your phone and show that if you're in the emergency room and you feel that your care that you're given is unfair, you're being unfairly treated. And so what I want to do is to let the public, as well as healthcare providers, understand that patients are aware of medical literature as well. Simple wording, whereas before it was not a part of the conversation. And I tell you the why question, and I've asked it all over the place, and most people say no. Maybe, they don't usually ask why. Could you imagine? And sometimes, I wonder how much of that not knowing why has caused somebody, the mortality.
Right. Well, I'm going to take up your recommendation and apply it to my own profession of teaching. I'm sure my students would say that that is an excellent recommendation for Professor Baskerville to follow. Ask why a little bit more to improve services. Because, and here I was being a little lighthearted there, but I do want to say that one of the things that I thought was really innovative in the program that you described was the insistence that professional service providers in whatever field they may be in begin to direct the analysis, the microscope, not at the people that they serve, but at themselves. And through the survey that you had medical staff take to identify some of their biases that were very much at odds with the reality. I mean, I noted the differences in poverty rate, literacy rate that were uncovered in your survey of medical professionals, I believe, at Kings County. And all of us would be well advised to ask ourselves how our implicit biases may color misperceptions about what is really going on when we encounter problems.
Yeah, and because the bias is not just related to lower socioeconomic groups in the Black community, it's across all socioeconomic status. Look at the experience that Serena Williams had.
Right.
I mean, hers wasn't related to, social determinants of health. And if you could look in my book, in the first page where the patient, she had sickle cell disease. She's a professor. And she says what Dr. Beverly is talking about is what I experienced. And please make sure you read the book. And she was a professor with sickle cell disease, which she states.
Yes.
I just want to what was I going to say? I want to thank you for coming. I want to ask you, in closing, what do you want people to get from the book? And any last words that you want to say about the subject?
Yeah, I think what I want, the takeaway is that if we solve the simple solutions, it does not have to escalate to the complex. And the human value, not to be judgmental to me, and to recognize, like I said, the bulk of us taking care of patients never laid in the hospital bed. And if somebody is confused or sad or not able to communicate what their concerns are, ask them, tell me what's important to you. And so we could now have a different conversation rather than you being judgmental about me and why I'm not doing something. And the assumption is what you think it is. Yet it's an opportunity to hear. And so what I want to accomplish is to have the processes that I put in place be sustainable. So I don't want health equity, what I'm talking about, to now go for 1 year, 2 years, and then go back to the past. If we're going to be serious about moving the dial from health disparity to health equity, we're going to have sustainable processes and results. And the cultural competence piece is so important. It has to apply to American-born physicians to foreign-born patients, which is a focus, which it should be, but also foreign-born physicians to American-born patients. And American-born physicians to American-born patients are, that are different than themselves. And these are just facts, there's an article, I just was at my reunion at Boston University and medical students that were interested in going into medicine. And I told them, there was an article in JAMA, Black babies in a neonatal ICU had a 30% decrease in mortality when treated by Black physicians. For the white babies in the NICU, there was no difference between who treated them. And I think these are just factual stuff that we need to understand and stop blaming the patients for the problem. Now, we're going to fix it for everybody. No. Are some patients, it's really should be blamed? Yes, but the majority of patients that I came across, speaking to 1,000, were not really to blame. It was because of perception reality issues. And so if I just have one, do I have one to tell you this particular story? I think it would resonate. Patient, African-American male, heart failure in hospital bed, and everybody said he was so, angry, disrespectful, and they said, Dr. B, you got to deal with him. Okay, we have had it. And I went in to see this gentleman, and you could see he was angry and just, So I said to him, "Good morning." I said, "Can I ask you a question?" "What?" was his answer. I said, "Could you tell me what's important to you?" And this same man, whose body language was that of anger and just offensive, he teared up. He started to tear up. The body language changed. And he said, "My granddaughter's wedding," who he loved over the moon. He thought this was around July and the wedding was in November, that he would not make it to his granddaughter's wedding.
Mm.
So I said would you, I bring the team in and I said, what if we did everything make it possible for you to make it to your granddaughter's wedding? Would that be okay? He said yes. So we jumped on and the team was very, very, collaborative. Make sure he had his medical appointments, he had medication, he had home care visits. And I told people off the record, if you tell anybody I jumped the line for cardiology, I'm going to deny it, So the first week in November, the same individual called back and said, I'm Dr. Beverly and your team, I'm so sorry for the way I acted. I said, no need for apology. We understand. He said, but I just want to let everybody know, you guys know, that my son is going to let me walk my granddaughter down the aisle, and of course, everybody shared tissues. And so when I said, thank you so much, and you have enjoy with your granddaughter's wedding. And of course, somebody on the team said, Dr. B, are we invited to the wedding? No. But these are stories, real human beings that gets demonized and I said, the bulk of us never laid in a hospital bed. And so, and everybody, so they just looked at his mannerism without understanding. So is this who this individual is? If he's not in the hospital, will he be the same person? And he was not, because when he called back and he came, and the first thing he did was apologize, and of course, the fear factor of dying before his granddaughter's wedding was what was driving him to behave that way.
Well, I want to personally thank you for your time, for coming on the show, and thank you for the work that you're doing and writing this book and educating people about this, because it's a very important topic. And we see that in, Black Westchester, we cover that in a lot of the topics we cover. The treatment we get because of our color of our skin, whether it's in law enforcement, whether it's in the medical institution, and in several institutions, we're treated differently. And I don't even think the doctors and the people that are doing it understand that they're doing it. And I think your book shines a light on that and educates people and, holds a mirror to the system, to hopefully change it. So I wish you well in all your work, and thank you for the work that you're doing, because like I said, it's very important. And, I've learned a lot listening tonight and talking to you the other day. And, keep doing what you're doing.
Thank you both so much, AJ and Robert. I really have enjoyed it as well. And the opportunity to be on Black Westchester Network newspaper is really great. Thank you so much. And you have a good evening. Okay.
Yes, thank you so much for joining us. And Dr. Beverly may be arranging to appear for book discussions at local institutions, including our libraries. And she'll be sure to inform Black Westchester if she does schedule an appearance, and we'll be sure to let our viewers and audience members know.
Yes, absolutely.
Okay.
Thank you so much, Dr. Beverly. Have a good evening.
You too. Thank you.
Okay. Bye-bye.
Now we're coming to the close of the show. First off, thank you, Dr. Bob, for bringing this guest to my attention. How did she come on your radar?
Actually, so Dr. Beverly, not surprisingly, given her background as a professional researcher, actually did some research and identified Black Westchester People Before Politics as a local venue with extensive reach. And so she sent I believe she sent a message to me, AJ. Actually,
okay.
yeah. So she took the initiative to reach out to us, and I'm really glad she did. Yeah.
Yeah, like I said, a lot of implicit bias and the treatment. We don't get treated the same in law enforcement. We don't get treated in the medical institution. We don't get treated the same in a lot of institutions. And it's a system that's the way they are built. And a lot of people don't even understand the implicit bias that they have when coming across us, the cultural differences and understanding. And one of the things I got from her is, the taking the time to understand and listen to the patient, and not just broad stroke one approach for everybody. You know what I'm saying? Because sometimes, even in our kids, our kids sometimes learn and process information differently in school. And for years, our kids will fail or get put into special education classes because the teachers didn't understand that. You know what I'm saying? So it's important to have people that look like us involved in these topics, and I'm glad that she's doing the work that she's doing.
Yes. And AJ, I got to tell you and the rest of the viewers that in reading the book, her fundamental insight in a way that perception shapes reality, in this case, the reality of the medical treatment that we get and its long-term effect on our health, could well have been taken out your mouth. You have, in our discussions, repeatedly noted the importance, even when people's perceptions are wrong, those in fact are the definitions of reality that they act on. And so
people's perception is their reality. Yeah,
a lot of overlap there. So this is an important book, and it's highly readable. I almost completed the whole book in a couple of hours. So it's not too difficult. I think people will find it both engaging, entertaining, enlightening, and economical in the sense that you can get through it in a decent amount of time.
Yeah, which is important, and it's not, what I got from you too is not also, a lot of times books like this are written, and you have to be a doctor to understand it.
Right.
Just like one of the first books that I was given in the music business, you had to be a lawyer to understand it. This business of music, it was just this thorough, thick book that if you really wasn't like a lawyer, or a high music executive, highly knowledgeable of all these things, you couldn't process it like as an average brother that just wanted to get in the business. You'd be like, and your eyes glaze over, and you just, you know what I mean? So it's more practical, and other people can understand it even if they are not medical professionals or don't understand, that level of things. So
yes.
that I think that's very important as well.
I agree, man. I agree.
Go ahead.
No, AJ. You go ahead.
Now, is there anything else in closing? Anything else you want to talk? Any other topics you want to hit before we get off this?
I mean, as always, there's a lot going on in the national scene that we could discuss, but I'll leave that to you, brother. If you feel that it's especially compelling and it's not to be avoided, then I'd be happy to have such a discussion. If you don't feel
well, I know a lot of people been hitting me, and I'm not, and some people are disappointed because I haven't written about them. Mm-hmm. I'm not going into a thorough thing about what Eric Adams is dealing with, mayor of New York City, and what Diddy is going through.
Right.
I saw Floyd at a benefit at a gala Friday night, and he was like, he keeps getting calls from all the people that are looking for quotes, and he's like, he's not quoting. We need sometimes. Now, I will say I don't condone the things that Diddy is being accused of. I don't condone none of that. I don't condone the behavior that we seen in the video with Cassie. Like that stuff you see with your eyes tell you what. But all the things he's being accused of, you got to let that go through the legal system. You know what I'm saying? And I also want to say, I'm not saying he's innocent. You're innocent until proven guilty. But let's stop always with the the narrative, oh, the feds are trying to take another black man, good black man down. Sometimes that's the case, and sometimes that's not the case. Let's just keep it real. You know what I'm saying? Some of the people need to be taken down, but we know that's the case. But we need to let the facts come out in all these situations. So, other than reporting that they were both indicted and and Diddy's case arrested and everything, that's all I'm reporting at this point. I'm not really having like a show on it. We're not going to really discuss it. And now Damon does know Eric Adams well. We may discuss more on Eric Adams on just who he is, and Damon may, but we're not really doing a lot on that. So, but I do want to this week. So I was able to go. I was invited to a couple of galas this week. Everybody was having their galas. I went to 2 of the 3. The first one I wasn't able to make it to because it was the same night. 2 of them were the same night. So shout out to YCOP. Organization that they do so much. Their work they do with our youth is incredible. They had their gala Thursday night at Green Tree Country Club in Rochelle. But Thursday night I actually went to Sister and Sister International. I believe it's their 30-year anniversary, their gala. It was, and I just want to say about Sister to Sister and about Cheryl Brannon. Dr. Cheryl Brannon, like I've gone to several organizations, galas and stuff.
Mm-hmm.
Dr. Cheryl Brannon and Sister to Sister set the bar on what the elegance and they set the bar with their gala. It was and I just wanted to say that. Then Friday night I went to the youth shelter of Westchester. Another great gala. This was at Sister was at the Glen Allen Harbor Club. Actually, my first time being there. Lovely place. I didn't even know that place was there. Like, it's funny. We live in an area and it's right there, and a lot of us don't go to that kind of stuff. So I have no reason to go over there. So I've never seen it, but elegant establishment. The youth shelter Westchester also had theirs at Green Tree Country Club on Friday. Great gala. They had DJ Envy from the Breakfast Club as the keynote speaker. With a very enlightening speech for the kids. And I also want to say the work that they do, I want to highlight. And we do celebrate, but I think we want to celebrate more. A lot of us, and Bob, you can speak to this, a lot of us have had our youthful indiscretions and even scrapes with the law, but we're given second chances and do a great job now. Like, this is what she does. She gives them kids a second, a chance, because some of them didn't have a chance. So some of it is actually their first chance. But right. She gives them a chance and sets them up for success, and to be great models of in society. And they're the only organization of its kind in the state of New York, not just Westchester, but in the state of New York. And they're located in Mount Vernon. And I think there's a house next door to their property that I think I was told years ago that they got first right of refusal when the owner sells it. Mm-hmm. And they might, and if they want to, if they get that, do a second youth shelter, but for women, for girls. Mm-hmm. They're doing for young men. They want to do that for young girls, like have it like right next door and do that. So I just want to shout out Joanne Dunn and her staff and all the people that volunteer and the board members, the work that they do for our youth, setting them up for success, and some of them giving them a second chance, an alternative to incarceration. And I think that's very important in our community. Again, some of us, make a mistake and then we just written off and we pay for it for the rest of our lives and we never get a second chance. She's giving these young men second chances. And I just wanted to speak to that. And again, like I said, I wasn't able to go to YCOP, but shout out to Henry Wilson and his staff and the work that they do. I definitely wanted to give them a shout out. Unfortunately, all these things were going on at the same time. And I think there's a couple more galas going on this week coming up. I won't be able to go to all of them, but these two organizations, Sister to Sister and Youth Shelter Westchester, I did go to theirs, and I was thoroughly impressed. So at the sister, they had Sunny Houston of The View. She was there for the cocktail hour, and she was talking about her book. It's on the other side of the room. So I
Something
think
like Brighton Beach. It's the third.
Sunny, something about a summer. She talked about these historically black beaches, like we have
Mhm,
historically black colleges, and how
mhm,
many there used to be, and how many there are now. And I
mhm,
think she's been going to some of them, and she's been
mhm.
writing a book about them. So I believe that's what it's about. But she's a Times bestseller, and definitely go pick up that book as well. And she was there, and it's good to see. Like I was, see people like DJ Envy come out for our youth and for an organization that really supports our youth. That was very important. And they had a bunch of keynote speakers.
Mhm.
The governor, the lieutenant governor, did a video presentation
Okay.
because he couldn't
Mhm,
be there in person. And there were other people like one of the speakers. He was like, "Yo, he had a brush with the law and did a decade in jail. Now he's this professional. I forgot what it is that he does, and he got that second chance, and a lot of people don't. I mean, a lot of people you and I both know that we went to school with never got that second chance. You know what I'm saying?
Right.
So
And AJ, I just want to amplify what you said, as many of our audience knows, and those who are friends of mine know that at a much earlier phase in my life, I also had serious brushes with the law, um, and was very fortunate thanks to the support of people like Brother Woodson and Joanne Dunn to be able to effectively transition off the streets, and went to Bronx Community College, and I had a whole bunch of Joanne Dunn's there, Gina and others who guided me through, Dr. Graham and others who guided me through the program and eventually helped me to get my legs underneath me. And it's really because of them that I can you know boast ever so slightly of some measure of success, because I got a degree, got my degree and became a professor. So, I that's a way of us reaffirming the importance of that work that they do, and our belief that a lot of people are going to benefit, whether we write them off now. They're going to really surprise us and do great things, and so we want to commend them for all the work that they're doing.
absolutely. And I wanted to,
Mm-hmm.
I keep saying YCOP. I wanted to say, so YCOP stands for the Youth Community Outreach Program. I've toured there. I spoke there. Spoke to the kids. They had me come through about one of my books, just talk, to the kids and to picture with them and engage with them. And they gave me a tour of the organization. Henry, Donna, all of them are doing great work. Like I said, I was unable to make their gala, but I wanted to uplift them because that's what Black Westchester. That's what we do. We uplift our organizations, and we want to thank all of you who are watching, who support. As we celebrate 10 years of giving you the news with the Black point of view and real talk for the community, we could not have done any of this without all of you, all of the contributors. There are many people behind the scenes who contribute articles knowing that we can't pay. You know what I'm saying? But they just want their messages that they thought needed to get out to our community, and they write. We got photographers that work with us, and they get paid to cover events and stuff like that. But they work with Black Westchester. You know what I'm saying? Because of the work we do, we got people that make donations monthly or whenever, and contributions just to keep us going. And more importantly, all of you who advertise, your advertisement, your donations, and your contributions enable us to be able to make the newspaper free, because information, one of the things I talked about when we first started this in 2014,
Mm-hmm.
information doesn't always trickle down to the most marginalized of us. You know what I'm saying? And if we was to charge even 50 cents or $1 for the newspaper, some of the information that we have in there wouldn't get to the people. And unlike a lot of websites and news sites, they're either a paywall for you to read, or you can only read a couple of articles that month, and then you have to pay to go further. If we were to do that, the information that we try to provide would not get to some of the people that need that information. And here with the show, we don't charge guests to come on. You know what I mean? We try to spotlight and highlight a lot of people. We talk about everything that affects the Black community. Conversations like this that we just had, we need to have more of those, because you hear most us talk about a lot of stuff with corruption and politics and police brutality and stuff. But these conversations are just as important. Cheryl Brandon, the sister, she came on and she talked a lot about the Black maternal health. And the work that she's doing. So I want to also compliment her and for that too. But we need to have all these conversations. We used to have Brother Rashad Bilal, before he did Earn Your Leisure, used to give our audience all the financial advice, the type of stuff he's doing on Earn Your Leisure, but he was doing it on a smaller level here, with writing articles and coming on the show at least once a month. It's all those people who have contributed something that me and Damon are still standing 10 years later. And then, other things, then people always ask how they can support. Maybe you're not a company maybe you don't have a company, maybe you don't have money to take out an ad. Like, donations of any size keep us going. You can see the links at the bottom. And also, Damon has a series of books. I also have 3 books. Buying our books is another way of supporting us individually. You know what I'm saying? So we are in better financial situations to be able to do this, because when this is not something we get rich off. This is not a friend-making endeavor. This is literally a calling. We do it for the people. We literally do it for the people. I know everybody yeah, right. Everybody says that, but I mean, we're still standing, and more importantly, unlike a lot of other people, we never sold out for a buck. Actually, Damon has infamously ripped up large checks that people have given us to try to buy our silence or buy us off. And I've actually turned down jobs with government because they weren't, which could actually help my finances and my whatever, my lifestyle. But the jobs were offered as a means to silence their greatest critic. You know what I'm saying? So freedom is not free. You know what I'm saying? So, but I always say, just like that song, one day, and it might not be long, you're going to look around and we'll be gone. We are here because of you. We've been here as long as we can because of you. And while nobody enjoys doing this, talking about money and stuff, it actually, I said, freedom is not free. And your support helps us continue to do this work. So thank you all who have supported. Thank you all who hear this and feel, support us with their wallets and not just their words. We greatly appreciate all of you. Any last words, Bob?
No, I'll just join you in extending a word of thanks to all the supporters of the show. As everyone is aware, this nation is beset by a crisis of democracy, which, as AJ just suggested, has a lot to do with the decline in the quality and availability of information about governmental affairs, especially local government affairs. And I think Westchester is one of the few counties that have a large Black population that can boast of having a newspaper dedicated to its issues and trying to help us to better understand how the challenges that the Black community confronts today are linked to some of those larger forces, whether they be national or even here in Westchester County itself. So big shout. I can tell you guys that the operation really does benefit immensely from your contributions, and I urge you to find a way to continue your support.
Absolutely. And also shout out, and this is what we got to do. Like, people try to put one against the other. Shout out to the Westchester County Press. They've been around for over 90, probably closer to 100 years. Mm-hmm. Support them as well. Like, you know what I'm saying? Like, we need to support our Black businesses. We need to support, we need to recycle our Black dollars. But, again, people always say, oh, this is what we need. We need our own voice in media to do these things. Well, when you have it, a lot of people who came before us, not just in Westchester, but in this country, have gone out of business because they couldn't continue to do what they were doing financially, or they end up having to use a pay model. You know what I'm saying? Which, the papers or whatever now you have to buy, but the information is not getting to all the people. So, like, literally keeping everything free for the people. This is a people powered movement. Literally, we are here because of the people, and there's many of you, and I greatly appreciate y'all. Like, a lot of people didn't think we would make it 6 months. A lot of people wrote us off in the beginning. Oh, they'd never be around. This is a blog with two noisy guys just want to make a bunch of noise and all that. And a lot of those people are supporters who used to say that. You know what I'm saying? A lot of people would be like, who are they? What do they do? A lot of those people found out the hard way who we were and the importance of what it is that we do. Shout out to my man Damon Jones again for asking me to join him on this journey. Like, when I came back to New York in 2014, you know what I'm saying? I in the beginning, I became a pin to his movement, and you know what I mean? And it was like, we were powerful individually, but together we changed the political climate in Westchester County and the surrounding areas. And, the next issue, like I said, the next issue of the newspaper is coming out in the next 10 days. If you would like to advertise, put a commemorative ad congratulating us, or just advertise to keep us going, hit us, blackwestchester@gmail.com. You got a couple of days to get it in. Again, advertising available on the website. Advertising actually available on the radio show in the beginning and the end. We don't usually have a lot of ads, but you can do a little video, 15-second little video ads. And then, we have ads on the website as well. And, like I said, donations and contributions keep this motor running. So enough of that. I don't say I want to, harp on that, even though that is important. I mean, even Shogun, you see PBS and all of them, they have marathons like once a year or something to raise money to keep doing what it is that they're doing. We haven't exactly had that, but like a marathon or something, but this would be the equivalent of that in our anniversary, celebrating our anniversary in our anniversary issue. This would be the equivalent of our marathon. And, thank you. Thank you.
Yes.
Yes. So with that, until next week, we're going to keep it short. Thank you, Dr. Beverly, for the work that you do and for coming on and for the book that you do. And we're going to try to do more, support more Black authors and have more Black authors on and do more spotlights. As again, like being a one-man band, writing all the stuff and everything. There's a lot of stuff we wanted to do. For all we do, there's so much more that we wanted to do that we can't do because I'm only one person, and you know what I'm saying, and we don't exactly have the finances to pay people, so it's like you get volunteers that come in on their time to do stuff when they want to do it.
Yes. So let me say yes and give an emphatic nod of the head. Also, let me say to listeners who may be considering asking us to review their book as part of a show, you can get a leg up on the process by reaching out either to AJ, Damon, or myself via email, and I know our emails are readily accessible. And you can also try to provide us with a PDF copy of the book as far as advanced as we possibly can, so that we'll be sure to have adequate time to read it. We would like to fully acquaint ourselves with your ideas, and that would be almost, that would certainly ensure that we would do so. So we'll be looking forward to hearing from all the authors out there in Westchester County who want to come in and share some of their ideas with the audience.
Yep. And Damon will be on next week or whatever, and he'll be telling you about his new website. And I know you can get all the books available, that and his series of vitamins and skincare stuff that he's trying to do. He'll tell you all that. He's got a website and everything coming. And all my books are available on Amazon, especially the first one. If people always ask how we got started and want to hear the story. I wrote a book about it, the Black Westchester, the origin story, so it's available on Amazon. It really tells you and gives you an idea like where we started at to, as now we're here 10 years later. So that's a great way to support Black Westchester as well. Sometimes my sister was saying, she doesn't give to political campaigns. She likes to buy a T-shirt or something, give some, so some people might not just want to do it. Buy the book. The book is a good way to support Black Westchester and learn about the story. So, go ahead.
I just wanted to add, AJ, that another way that they can support Black Westchester, if they would like, is to take out a subscription. I believe that.
Yeah, we're gonna get that back. We the thing on the website wasn't working, so I haven't really been pushing the subscriptions lately. But if you definitely want to take a subscription, hit us at blackwestchester@gmail.com. It's like $30, and you'll get the paper mail to you wherever you at. I'm going to be picking that back up over the next couple of months. So we had dropped that for a while. It wasn't consistent, and the link on the website didn't work. So, but we're working on all that. Trying to tweak it, and we are now live simulcasting on several different outlets.
Say that again for me, please.
Simulcasting.
Okay.
Yes, so we are live. We're not just live on Facebook. We're simulcasting at the same time on Facebook, on several pages, on LinkedIn, on multiple pages, on YouTube, on X, formerly Twitter, and usually on Instagram. I didn't do the Instagram today, but usually on Instagram. And then you can all see all the previous shows on the Black Westchester YouTube channel and on blackwestchester.com. We archive all the shows so you can see all the shows and go check out some of the earlier articles. Go through the site. And more importantly, you see something you like, leave a comment. We need more public engagement. You know what I'm saying? So you don't like something, leave a comment. Let us know what you think. We want to hear from you. We want to hear from all of you. So thank you for everybody who tuned in. Seems like X tonight, some of the nights, got most people were tuned in on X, a few people on LinkedIn,
okay, and
YouTube and Facebook. But X seems to be one of the biggest viewerships right now. Yeah, mm-hmm. So tell a friend to tell a friend. If you're watching on YouTube, make sure you hit the subscribe button. Share this with everybody. Leave the comments at the video on the website so, we can mess with that algorithm. We keep that algorithm getting us, you know what I'm saying? All the comments and feedback, help with the algorithm. So with that said, until next week, we're out of here. This has been another episode of Black Westchester Presents, the People Before Politics radio show. We're on every week, usually from 6 to 8. Sometimes, we don't have guests, we might not be on for the whole 2 hours. Sometimes we have great conversations. We're on for over 2 hours, like last week. I think it was last week. Yeah, Damon and Mayo went on we wasn't off till 9. I left the show. They was on till 9 last week. But usually 6 to 8 every week. And again, last week to advertise in our anniversary issue. This week, blackwestchester@gmail.com. Hit us. Until next week, peace.
22 million black victims of Americanism are waking up, and they're gaining a new political consciousness, becoming politically mature. And as they develop this political maturity, they're able to see the recent trends in these political elections. Any minority that has a block of votes that stick together is in a strategic position. Either way you go, that's who gets it. You're in a position to determine who go to the White House and who stay in the doghouse. You're the one who has that power. You and I have never seen democracy. All we've seen is hypocrisy. Today, and look around America, we see America not through the eyes of someone who has enjoyed the fruits of Americanism. We see America through the eyes of someone who has been the victim of Americanism. We don't see any American dream. we've experienced only the American nightmare. We haven't benefited from America's democracy. We've only suffered from America's hypocrisy. And the generation that's coming up now can see it. And our